Hello everyone, we are delighted to have with us today Dr. Shireen Mirza, Associate Professor of Sociology, and we're thrilled to have you here today, ma'am.
Thank you so much. I'm happy to talk to you, Aleena.
Ma'am, often when we think of mental health, we focus on the psychological and medical aspects of it. But sociology, I believe, gives us a broader understanding of how society, community, culture also affect mental well-being. That's why we thought it would be interesting speaking to you about mental health and, of course, you being a sociologist yourself on this day of World Mental Health Day.
Yes, I think this is the first time I've been asked to speak on mental health as a sociologist. Although sociology and psychology are sort of allied disciplines, both seem to think about the individual. But sociology takes it beyond just individual psychology into the broader world that we live in and culture and society, as you say. So yes, mental health should be actually looked at more in terms of the development of societies and people within them.
So just to begin with, could you explain how sociology helps us understand mental health beyond individual experiences?
So since sociology talks about something called the sociological imagination, which actually helps us think about the individual as being part of structures within society. And by structures, I mean something like economy, public state policies, religion, the family as a structure. And so what it does when we think about mental health and say something like anxiety or something like loneliness, is that it takes it away from an individual problem. So it's not about what is wrong with me or why am I going through this. And it takes it away from pathology into a larger perspective where you see the ways in which the individual is affected by what goes on within like the economy. So for instance, anxiety, you could think of it as I'm feeling anxious because I'm constantly being told that I have to be the best, and this comes from an idea of competition, which comes again from capitalism, and so on, right? Or say, for example, loneliness. So I'm constantly feeling lonely because instead of saying it as something that is a problem with you, you then actually are able to think sociologically as part of I'm lonely because the way society is structured and families have structured has changed so much, from village to joint families to now nuclear families to then an individual. So as an individual, I am responsible for all my decisions, right? And so, you are able to one is connect and realize that you're not the only one going through something. There are people, like you who are facing the same kind of problem. You also realize that problems are not necessarily generated by you. Problems come from something larger, right? So precarity or economic insecurity is part of large changes of society. Or even how families have changed. So also say another instance, you take, say, farmer suicide. You again realize that, when you have a whole lot of incidents of suicide in a certain particular location, and it actually points to a larger breakdown. Or Dalit suicide, it again points to a larger breakdown. So sociology helps us actually make those connections and take it away from the individual and it gives a perspective where you see the individual as part of a larger ecology.
Right. That really does elucidate how mental health is so much more beyond just individual experiences.
Yeah.
And how also it is interconnected with broader societal factors. But also, ma'am, could you speak a little on the social determinants like income, education, housing? How do these sort of shape mental health?
Right. So, in sociology, one of the founding sort of theories of on mental health, which is by someone called Emil Durkheim, and his theory of suicide, where he actually does an empirical study, and what he finds is very interesting. He says that, there's something called a rate of suicide, which is like number of people who commit suicide divided by the total number per year, and he finds that this rate remains constant, and that it actually is the same across different groups. So he finds that white European men are most prone to commit suicide compared to any other group of people, right? And his reason, and he was interested in actually not understanding it through a subjective or individual or a psychological experience, but by actually seeing it as part of, again, larger structures, right? And the reason he finds that, you know, that it's not about an individual problem, but something far more larger, or one can see it socially if you look at the statistics. His explanation boils down to one word, which is integration. And what he finds is that groups that are highly integrated, where, you know, people exist in a larger collectivity, where members are enmeshed, where social bonds are stronger, those societies have less rate of suicide. That's what he argues, right? Simply because when bonds are stronger, we're able to absorb something like trauma, we're able to absorb something like individual failure, we're able to absorb breakdown. That's the explanation he gives. And particularly in the times that we're living in, right, which is urban living, city living, climate change, where, you know, you have a breakdown of even all kinds of communities, right? It's all about you for yourself. You also have the withdrawal of the state. So the state is no more investing in education. It's no more investing in creating public sector jobs. Then there's a certain kind of precarity, and one has to really understand what one is going through as part of that larger structure, right? And so something like income, education, housing are, if one thinks of it sociologically, it's part of larger the role of the state, the role of, you know, say the rise of authoritarianism, the rise of polarization, all of that. It's all linked to what each of us individually feel. High amount of competition, social media, all of that really determines what we go through and our mental health. Yeah.
Ma'am, you mentioned of how strong bonds and family structure, how these also contribute to sort of expressing a form of mental health, and especially when you're going through a breakdown. I'm a little curious about how, just if you could be more specific of how family structures and support systems affect mental health.
Right. So, you know, earlier in what anthropology we got traditional societies or tribal societies, you always had, the idea of a god, right? Something larger than you. You had the idea of a spirit. You had the idea of the church, the priest, somebody who could redeem you, right? And now with all of that going, it's just the individual. So who I marry is my choice. What job I do is my choice. There's really that support, that level of guidance. All of that is gone. So my failure then becomes something that is a result of my doing, right? So then, you know, all the mediation that we had, all the shock absorbers in some ways have absolutely gone. And that breakdown actually, and which is why we see that in Western societies, mental health, it becomes far more, interestingly spoken about, but also something larger, right? It's in a way that, we are now seeing it in our societies and in our contexts.
So then shifting to workplace, how do you think work culture is having an impact on mental health? And do you think there's more that can be done to support mental health in professional environments?
Yeah, you see, when modern institutions are probably the sort of, new and only spaces where we expect people to show up being fine and to show up as something, as the intellectual being and not as an emotion. So you're supposed to leave your emotions at home, you're supposed to leave all your baggage at home, and there's a certain mask with which we all sort of show up at our workspace in a way which is very different from, say, how you show up in a church or how you show up in a community gathering, right? That's where all your crises and all of that can be addressed. So, and workspaces are also places where stress is created, right? There's a sort of an artificial emotion, right, of either elation and constant stimulation and need to actually perform better than others, and so on, right? So workplaces are a huge producers of crisis and mental health problems. And I think workspaces need to address that and have various kinds of structures so that employees feel that there is some form of redressal, for some form. But of course, when income and all the other factors are taken care of, then that really helps in ways employees experience their mental health.
Right. That explains so much of how even work culture and workplace needs to have some change in terms of reducing just the burden, the responsibility, which can have a toll on your mental health.
Absolutely.
And at what cost.
Absolutely.
Ma'am, one more thing I think we should be talking of on this topic is social stigma. It is such a big issue when it comes to mental health. So my last question would be from a sociological perspective, what do you think communities can do to reduce the social stigma on mental health? And also, do you think social stigma varies across different cultures?
Yeah, well, definitely in the Western context, there's been so much conversation and there's so much realization on mental health in a way that hasn't happened with ours. It's only, I think, off late that I know we're seeing like a mental health epidemic, and there's so much conversation. And because mental health is a bit like your bodily health, right? You don't question why your body gets sick. Why then would you feel shy about your mind getting sick? Just as your body needs to be taken care of, you need to exercise, you need to, have your tests done and so on. Your mind also needs that kind of taking care of, right? That kind of attention. So I think things have changed. I think at least with your generation, I think that stigma, I think we've long crossed that. I hope we have actually, and I think we should in fact taken the opposite direction, where we have to say that just like we used to fat shame at some point, or people who didn't exercise were not considered cool enough. I think it should be the same with mental health, right? So those who kind of are not ready to have this conversation, or those who are shying away, there should be some stigma attached to that, right? It should become normal to think about mental health, to talk about it, it should be like a part of an everyday normal conversation, right? Just as it is with your body, it should also be the same with your mind, right? Because the body and mind are very linked in that sense. So I think it should be stigma, I mean, not just removing stigma, but the opposite, right? You stigmatize those who don't want to talk about it, because it should become normal, right?
Like you said, ma'am, I think the first step we can probably do to reduce the stigma is just simply having a discussion on mental health like we are right now.
Yeah, absolutely.
And it can start from that.
Yes, I think in BITSLAW we've been doing a lot. We have, from the very beginning, I mean, it was part of our first orientation. So I think mental health, thinking about it through empathy, through kindness, having an open conversation institutionally, I mean, this has been part of our mandate.
Right.
Yeah, it's part of also our curriculum. So the English course actually talks about mental health, sexuality, mental health, gender, all the stuff that we're talking about, right? It comes in sociology as well. So this is we take it seriously. We take it both as a public conversation, and as a very important part of our own nurturing and upbringing, or as part of us becoming good citizens, but also good professionals, that we reflect and we understand one another.
Very, very rightly said, ma'am.
Yeah.
And thank you so much again, Mr. Shireen.
Thanks, Aleena.
For your time.
Thank you for this nice
and
conversation.
bringing more awareness to the societal factors affecting mental health.
Thank you.
And yes,